Hello, my name is Vikram Singh, and we are here at AICS in Silver Spring. Today is May 3rd, 2015, and we had today Health Expo, which was organized mainly by AICS, and we have two prominent members, Dr. Sam Mukherjee and Dr. Suresh Gupta. So we'll talk about today's event and about some kind of background for AICS. So I'll start with Dr. Sam Mukherjee. So could you please tell us about AICS, what was the idea behind it, and how it got started, and how long you are involved in this plan, and what kind of future plans you have?
Yes, AICS stands for Asian Indians for Community Service.
Yeah.
Now in the year 2004, we founded this non-profit organization to be a little different from all the others. We in the Asian Indian community here in the USA, the majority do either religious organizations, political organizations, education, but there were very, very few, if not none, who were doing community basic healthcare services. So that was our starting point. And we had a like-minded group of like-minded people who got together. We founded the organization, and we had a rapid rise in our activities and recognition all over, because we started partnering with different organizations, including the local government, that is the county government, the state government, etc., through whose programs and funds we became a part of it. Yeah. And that is how we have been expanding.
And I saw like a lot of today, like a lot of activities were going on about regarding the mental health programs, and then some education about Lyme disease and some other things. And by looking at the Obamacare came into picture, can you see how was your past experience and how things are moving forward, and how it is more helpful for senior citizens or visiting parents?
Yes, you asked me a couple of questions in one, and
Yeah,
I'll try
yeah.
to address them. First of all, there are different programs related to different disease prevention,
Yeah.
which we have been doing, like free cancer screenings, free blood work to determine if somebody has a hepatitis B in them. And then we have senior citizens programs, and the latest one is the mental health.
Yeah.
Now, mental health, the program that was launched today by Asian American Health Initiative, who are our partners at Montgomery County,
Yeah.
focuses on the Asians. And when you say Asians, why? Because the needs of mental health for Asians is very, very different from the general population.
Yeah.
And this is where the focus is different.
Okay, I'll ask some question to Dr. Suresh Gupta. I know you have been in this field, I think, for around 25 years. You're working as a doctor in Maryland, and you're having senior positions here. So what kind of thing have you seen, have you noticed, and what kind of contribution is coming from the medical side to help our Asian community especially?
Thank you, Victor. I came to this country in 1981. In 1986, after my training, I started my practice. This past about 30 years, I've been practicing in this area. And I think after accomplishing what we all achieve and look for, it became necessary and must to give back to the community, which after met Dr. Mukherjee and a couple of other people, we started this. And it become our passion for us and many others in the community that we see, is to give back to the people who are uncared, caring for them,
Yeah.
needy, they need our help. So we launched this program for health fair, health screenings, as Dr. Mukherjee mentioned about hepatitis B, or there is a Lyme disease with the vaccination during flu time. So we do this screening for that people who cannot get out of their basements, they can come and see us at no cost to them. Something we feel good when we go.
Yeah, that's very nice of you. And I'd like to thank you, everyone, and especially Dr. Mukherjee and Dr. Gupta, and we have so many volunteers, and also like Suresh Singh ji, who is not here today. And they are so dedicated to this cause, especially for the Asian community, and who, like especially for the mental health program, they don't come forward. So they encourage a lot. They put lot of their time, lot of their efforts, talk to the county, the government. So I'm really thankful to them, and I'm really proud to be part of this Asian AICS organization.
Thank you.
Thank you.
Thank you.
Thank you.